World Vision staff deliver a truckload of medication to treat cholera patients at this health center in Mahana, a small village close to the banks of the Niger River. It's the rainy season in the Sahel, and keeping cholera at bay is an ongoing battle. Center Director Dr. Djibrou Soumana says the center registered 147 cases of cholera between May and July. 7 of the cases turned fatal, including 2 teenage boys and 1 9-year-old girl. They waited too long before coming here. That's what we call référence tardive. In addition to waiting too long to seek treatment, Soumana says a staffing shortage at the beginning of the ordeal had an impact on the ability to save lives until additional staff from the district hospital arrived to help. On this particular day, the doctor is thankful that his last cholera patient has checked out, and for the fresh supply of oral rehydration salts and Ringer solution, both used in the treatment of cholera, along with Aquatab, which is used to treat water from the river. Nearby, people are bathing and washing their clothes in the muddy brown water of the Niger River. Some also defecate near the water, creating a health hazard for others. I come to bathe, fetch water, and drink. This 22-year-old mother of 2 girls says the family sometimes drinks untreated water if Aquatab is not available from the center and money is tight. Dr. Soumana says another problem is some say they actually prefer the taste of the untreated river water. When we do the sensitization, we told them to consume treated river water. They said no, they prefer the water from the river because it has a good taste. The men of the village of Kukuru help unload another delivery of medications by World Vision to their clinic, which was also hit by the cholera epidemic. On this particular day, there are 3 cholera patients being treated on site, including 7-year-old Abdul Fatahu and his grandmother.
He say he's vomiting.
His mother explains Abdul became sick after drinking contaminated groundwater. A common problem, according to Dr. Tari Murtala, as this family lives in a village 12 kilometers from the health center with no boreholes to provide a source of safe drinking water. During the recent outbreak, Dr. Murtala says the clinic handled 71 confirmed cases of cholera, including 8 deaths, 1 a 7-year-old girl. He says some patients waited too long to get treatment, dying within 2 or 3 hours of admission. Another challenge, not having enough staff on hand to handle the number of admissions they were dealing with at the onset.
One only person to watch all over these patients, more than 30 patients having intravenous solutions being perfused, and only 1 person cannot do it. Even 2 cannot do it.
The doctor says additional staff were sent from the district hospital to help. In addition to distributing medication to health centers, World Vision recently signed a memorandum of understanding with the Tillabéri region, vowing to fund efforts to combat cholera through the training and retraining of health workers and volunteers from the area. Dr. Idrissa Mega, Director of Surveillance and Response to Epidemics, says this effort will contribute to the fight against cholera. We have always said that the government alone cannot satisfy all of the needs in terms of health, and that's why we've asked the districts with their partners in close proximity, like World Vision in the Tillabéri region, to see what are the possibilities and support that they can give there in the fight against cholera, and that's what World Vision has done. However, Mayaga says staffing during the outbreak of cholera is always a problem. Doctors and nurses were hired back in February to help staff the health centers, and health agents are being redeployed to affected areas. World Vision Area Development Program Manager Boubacar Issoufou says getting involved in the fight against cholera makes sense, as they have around 1,200 registered children in the programming area that has been impacted by the epidemic.
I'm sure the families of those children are concerned with this disease. So we have to help them, because if we're trying to tackle issues related to child well-being objectives, I think one of the objectives is children are well-nourished. Children are protected from disease and infection.
The fight against cholera also includes educating communities about proper hygiene and promoting the disinfection of drinking water. While the number of confirmed cholera cases has been decreasing in recent weeks, August is the peak of the rainy season, which can mean an increase in the number of people drinking from contaminated groundwater. So being prepared is key. Reporting from the Tillabéri region in Niger, this is World Vision.